Doctors say monoclonal antibodies are an effective way to treat COVID-19 patients, but with a surge of cases and a lack of supply, South Carolina doesn't have much to give, any in some cases. News 19's Julia Kaufman joins us now with those details.
Monoclonal antibodies are lab-produced molecules that mimic the immune system's attack on virus cells like COVID-19 that can potentially be dangerous. Every state receives shipments of the antibodies for healthcare providers to treat COVID-19 patients. Just last week, Governor McMaster was promoting monoclonal antibodies, saying they're proven to be effective in helping fight serious illness from COVID. But now, South Carolina doesn't have any to give.
There have been orders of approximately 13,000 doses that have been made by providers of antibodies since August 30th that we need to make up in some way.
All those orders have now been canceled. Melanie Matney with the State Hospital Association says the federal government is reworking the supply system and a new small shipment will go out in a few weeks.
We have not really received significant antibodies since late August, so there is already a backlog of patients and people who need antibodies. Hospitals and other providers have been working with their current levels of supplies. So now there's starting to be a much greater demand and a much greater need for antibodies.
While demand outweighs supply for the antibodies, Senate Minority Leader Brad Hutto says this highlights the importance of getting vaccinated.
If people are thinking, well, I don't really need to get the vaccine because I can wait, and if I do get COVID, I'll get a monoclonal antibody, we don't have any right now. There's not enough being produced for South Carolina to have what we need.
Matney filled in Hutto and other leaders of the General Assembly on the supply issue Wednesday morning.
It was suggested to us that one thing we may want to promote is that people get the monoclonal antibody because it was showing good results. Then flip forward till today, apparently so many people are asking for it that there's not enough of it being produced, at least on a temporary basis.
Leaders of the General Assembly meet with the Hospital Association weekly for COVID-19 updates. Hutto says lawmakers will likely return to the State House this fall to allocate more federal funding to hospitals when they need it. Matney says South Carolina expects to receive around 4,000 doses of the antibodies from the federal government in a few weeks, and they're working to decide which providers will need the treatments most. In Columbia, Julia Kaufman, News 19, WLTX.